Hello, everyone. There is a condition that I believe anyone who has a pet will experience at least once in their life, which is diarrhea. For some pets, diarrhea can go away on its own after 1 or 2 days without treatment. But for others, diarrhea becomes severe, accompanied by vomiting and loss of appetite, resulting in death. In today's video, I will help you understand what diarrhea is, the causes, and what to do when your pet has diarrhea. And now, let's get to the content of the video. First, let's find out what diarrhea is and whether diarrhea is dangerous or not. Diarrhea is a condition in which the stool is not formed or loose and is accompanied by frequent bowel movements in a day, usually more than 3 times a day. You need to remember that diarrhea is not a disease, but a symptom of many different diseases. If diarrhea is caused by simple reasons, such as digestive disorders or worms, you can solve it simply and your pet will recover quickly. But if diarrhea is the result of dangerous diseases, such as liver failure, viral diseases, such as Parvo or Carre, or also tumors in the digestive tract, or other disorders, such as intestinal obstruction, diarrhea can threaten your pet's life. You also need to note that mild diarrhea can also become dangerous if you do not treat it early and properly to prevent your pet from dehydration and electrolyte disorders. Therefore, never be subjective when your pet has diarrhea. What are the causes of diarrhea? There are many causes of diarrhea, but to thoroughly understand it will take a lot of time and require professional knowledge. That's why, in today's video, I will share with you the most common risks that pets often encounter. For ease of remembering, I will divide them into 2 groups. The first group is the groups whose main symptom is diarrhea. This group has causes that are often simpler and easier to detect. It can be infectious enteritis. It can also be caused by viral enteritis. For example, in dogs, it is Parvo, Carre, or Corona. In cats, it is leukopenia. In pets under 1 year old, there's also a fairly common cause, which is worms. For young pets who have the habit of biting and gnawing on things in the house or eating things in the trash, there is a reason that they may accidentally eat a toxic substance that leads to poisoning, or may eat food that cannot be digested and leads to intestinal obstruction. There is also a more basic cause that is due to you suddenly changing your pet's food or feeding your pet foods that can easily irritate the digestive tract, such as fresh milk, seafood, or greasy foods. The second group is the group that, in addition to diarrhea, also has other systemic signs, such as rapid weight loss, jaundice, drinking a lot of water, urinating a lot, coma. These are signs of complex diseases that you need to take your pet to see a veterinarian. How to determine the cause of diarrhea? Usually, determining the cause of diarrhea is a multi-step process that needs to be performed by a veterinarian. The veterinarian will have to rely on the condition of the stool and the condition of the pet. The condition of the stool includes the color, looseness, smell of the stool, and the number of bowel movements. And the condition of the pet, such as still eating or not eating, whether dehydrated or not, and whether there is pain when touching the abdomen or not. In addition, the owner's information will also be needed. For example, before the pet had diarrhea, whether the pet was fed anything strange or not, whether the pet was vaccinated and dewormed or not, whether the pet was let out on the street or ate anything strange or not. That is the information that will help the veterinarian narrow down the cause of the diarrhea. To determine whether the pet has a viral disease or not, the veterinarian will use a rapid test strip, and if the test strip shows 2 lines, it means your pet is sick. To determine whether the pet has worms, bacteria, or single-celled microorganisms or not, the veterinarian will use a microscope to observe the stool sample. And for more complex diseases, the veterinarian will recommend performing specialized tests such as blood tests, ultrasound, X-rays, and sometimes endoscopy will be necessary. After finding the cause of diarrhea, what to do next? The first thing you need to do is eliminate the cause and treat the symptoms your pet is having. If your pet is in a mild condition, such as digestive disorders or bacterial enteritis, the veterinarian may prescribe digestive enzymes and some antibiotics for you to give your pet at home, along with instructions on changing the diet. However, if the diarrhea is more severe, for example, your pet may be accompanied by vomiting, severe dehydration, or gastrointestinal bleeding, your pet may need to stay in the hospital for IV fluids and care. Because when a pet vomits and has severe diarrhea, the pet will not be able to eat or drink, nor will it be able to take oral medication, and IV fluids will supplement nutrition for the pet, as well as deliver medication directly into the vein. That's all I want to share in today's video. If you find this video interesting and useful, please like and share the video. In the next video, I will share with you remedies and measures to help you treat pets with diarrhea due to simple causes at home. In order not to miss this video, please subscribe to the channel to receive more useful information on pet care and treatment. Thank you, and goodbye to all of you.
Thank you for visiting. We'll see you next time.
Oh!